back then we were trying to stay open, and we were considered, like Jim Jones kind of crazy people, because we're, fasting people, for goodness sake, and putting them on whole plant food diets. We're getting sicker. And then we're dying from diseases that used to be rare that are now ubiquitous. You have a better chance as a physician curing a heroin addict than you do helping people lose weight. How long you live is largely genetics and luck, but how well you live is largely the choices you make.
Welcome to Metabolic Matters Podcast. Let's meet today's guest.
Hello, everybody. This is an absolute honor for me to have with us today someone who has been part of my own journey over 3 decades now on my own recovery and ongoing maintenance of my health after facing a terminal cancer diagnosis. Right before the video started, I was trying to get a sense of when my path began crossing with this lovely human's path, which was in 1991. And he had already been at it for a good 6-7 years. 1984 is when he began his work. And if you are not familiar with the work of True North Health Center and the work of Dr. Alan Goldhamer, you are in for a treat. At this point, I believe he's somewhat of a household name. At least his clinic is. And I have had the pleasure and privilege of sending probably hundreds, if not thousands of patients to you and your offerings for many years. And I feel like you bring so much light and life to the world. So thank you, Dr. Goldhamer. Thank you so much for being here with all of us today.
I'm glad to be.
Fantastic. Well, boy, howdy. I'm sure you have watched things come and go. I know if I talked about fasting early on in my medical career with my patients, I had to almost whisper it in the clinic, right? It was something you couldn't really talk.
Early on, that we were considered criminal quacks. I mean, let's keep a very low profile. In fact, it's interesting that even today, 50% of our patients come from outside the state of California. About 15% are from foreign countries. We have a very small percentage of patients that are actually local to Santa Rosa because we've never done any marketing, advertising. We've never spoken publicly in the local community. It was always away because back then we were trying to stay open, and we were considered, like Jim Jones kind of crazy people, because we're, fasting people, for goodness sake, and putting them on whole plant food diets. And 40 years ago, that was not considered in the same way it might be today.
And thanks to probably the biohacker community, love or hate them sometimes, they've really let us come out of the closet in a pretty big way. There's been a lot of amazing research in the longevity research world that's really brought it out. And there's actually been a lot of this in my world, in the oncology world, which I hope we can dive into a little bit during our discussion today about some of the research that honestly isn't new, but we've also kind of dusted off from the archives and pulled back out and started to do even further studies there. So before we dive into those juicy details, Dr. Allen, I would love for you to tell us a little bit about, kind of the concept of fasting. There may be at least a couple of listeners who are not as familiar with it or who are still a little bit nervous or gun shy about it. But could you explain the concept and how the approach you take at the True North Clinic might differ from what is sort of popularized on social media?
Well, I think the first place that we should start talking is about why would we even worry about fasting or anything remotely sounds like fasting? And I think that's really clear. Today, since the last, say, 200 years, we've transitioned the diet of humans from being whole processed foods, which is whole unprocessed foods.
Right, exactly.
Yeah, to being ultra processed foods. So for 200,000 years, we ate fruits and vegetables and things like you find them. In the last 200 years, we've been transitioning to these ultra-processed foods, where basically we take chemicals like salt, oil, and sugar, use food as a carrier agent, and then deliver those with chemicals to the palate. And the consequence of that is we've learned to fool our satiety mechanisms with what we call the dietary pleasure trap. And so people overeat. And when they overeat, they gain fat. Now, fat, nothing particularly wrong with fat per se. It's a necessary food storage component on the human body. It provides a lot of important functions. The problem is when you get too much fat, about 10% of that is called visceral. And that's the fat that tends to accumulate around the belly and in the organs. And it's hypertrophic and hypermetabolic, and it gives off inflammatory products that are associated with a variety of diseases like cardiovascular disease and diabetes and autoimmune diseases and some forms of cancer. And the problem is those conditions are all treated as if they're completely independent. You have to get like different doctors to even be diagnosed and treated with these different conditions, but they do have a common relationship to the inflammation that's associated with excess dietary fat, particularly excess visceral. So as we get fatter, because we're fooling our satiety mechanisms because of the hyperprocessed foods and the chemicals we're putting in the food, we're getting sicker. And then we're dying from diseases that used to be rare that are now ubiquitous. They used to be called the diseases of kings. It was only the wealthy kings who could afford to eat the concentrated hyperprocessed foods that gave them the gout and gave them the heart disease and gave them the premature cancer. And as a consequence, we've got a whole society now where 72% of people are overweight or obese. If you're not overweight, you're actually abnormal.
Yeah. We're now yeah.
So then the question is, okay, well, why don't we just stop? Go back to eating whole processed foods, lose the weight, and reduce the risk factors, get rid of the visceral. It turns out really hard to do that because we become addicted to the artificial stimulation of dopamine in our brain, just like people on alcohol do, or coke, or methamphetamines, or salt, oil, and sugar. So these chemicals all are acting on these same neurochemical pathways. And it's not that easy to just look. If you go up to an alcoholic and you say, oh, you know how your life sucks? It's because of the alcohol. They don't go, oh, it's the alcohol? I had no idea. Thank you so much. I just won't drink anymore. Because, it's very difficult. So in fact, if you go to an inpatient program for alcohol treatment, spend $40,000 for 30 days. You go to 90 visits in 90 days to a 12-step program, and you have family support, the chance that you'll be drinking again within a year is somewhere between 80 and 90%.
Right.
Failure rate for heroin addiction exceeds 90%, even if it's court mandated. But to lose 5% of your body weight and keep it off for a year, the chance of that happening is actually only 5%. So you have a better chance as a physician curing a heroin addict than you do helping people lose weight.
Wow.
Because at least with heroin addicts and alcoholics, we tell them the truth. You need to stop drinking. You can't deal with the chemicals in alcohol fooling your brain, and you need to stop. Whatever strategy you come up with, you got to figure out how to stop drinking. We don't tell overweight people that, even though it's the truth. Oh, you don't handle the satiety stimulation of oil, salt, and sugar. You need to eat a diet that's whole plant food. No, we tell them, well, change the color of your meat from red to white. Put your food on a smaller plate. Chop the food up in little bites and then put your fork down between each bite and you won't be overweight anymore. And the chance of that working is about the same as treating alcoholics by telling them to drink beer and wine. We don't do that with alcoholics. We shouldn't really do it with overweight people. We should tell them the truth. The problem is alcoholics don't want to be told you got to quit drinking. And people that are overweight don't want to be told they have to change their diet in order to go lose. They want to believe in magic. And so the problem is, since the recidivism is so high, many doctors just give up. They say, look, people do not lose weight and keep it off. There's no point in me wasting my valuable time yapping to people about things they don't want to hear. And so that's a long way of trying to explain essentially how we came about the idea of fasting as being a useful tool of escaping the dietary pleasure trap, helping the body overcome the inflammation associated with disease, so that then you could motivate people to make diet and lifestyle changes so they could sustain long-term. And that's exactly what we've been doing for 40 years. For 40 years, 25,000 people walk into True North Health, and so far all 25,000 people have walked out. And we're working really hard not to screw our safety data. So appropriately screened patients that go through appropriate monitoring during fasting can do this safely. We've done a fasting safety study. We've shown this in peer-reviewed literature that this protocol, when it's followed, can be done safely and it can be effective. In fact, Walter Longo, who's a UFC researcher who's done fabulous work on intermittent fasting, published a book saying, don't ever do long-term fasting like we advocate, because it would be too dangerous. Except, he said, if you do it at the True North Health Center.
Exactly.
And since I evaluate other researchers' intelligence based on how much they agree with me, I consider him a genius.
But he's
But the
he's
point
not
is,
because he
before we
helps.
fast,
Right.
this complete abstinence of all substances except pure water only.
Yeah.
So this isn't drinking cola and having other types of intervention. This is the complete abstinence of all substances except water in an environment of complete rest, there's three things that have to happen. First, you need to make sure the person's a good candidate for fasting. And the
Absolutely.
way you do that is with a medical history of physical exam and laboratory tests. Because you can't always see, just because somebody's overweight doesn't necessarily mean they're a good candidate for fasting. It depends on what medication they're on. It depends on what their medical history is. It depends on their situation. And the only way you really know that is with a competent physician who bothers to take the time to review the medical history, do an examination, and order appropriate testing, and then interpret that. And then let's say you're a good candidate for fasting. Then there's a couple things that have to happen during fasting to make sure it's safe and effective. One is you have to rest. People think, well, I'm trying to lose weight. I want to be really, because I'll lose more weight. And you will, but it won't be more fat. What it'll be is more lean tissue because you're mobilizing gluconeogenesis through a process of depleted glycogen stores. Once you've depleted your glycogen stores, the only place to get the glucose you need to increase brain activity is through breaking down lean tissue. So by resting and fasting, we maximize fat loss and minimize lean tissue loss. And then once you're done safely fasting, perhaps the trickiest part of fasting is careful refeeding.
Yes.
So too rapid a return to refeeding can lead to post-fasting edema or even refeeding syndrome, which at least theoretically could be fatal. Now, we've managed to do 25,000 consecutive patients and never see refeeding syndrome. So we know according to the protocol it's followed, that doesn't happen. But it theoretically could happen. And we certainly see people that are maybe making poor choices when they're fasting on their own and they're too active and they're doing things that really end up being a mess, end up in some emergency room and get hyperhydrated by a well-meaning physician and send into failure because a lot of the doctors have never actually seen people fasting and they've certainly never seen people get well. And so they're not used to looking at what that looks like. If you go to most physicians, for example, and you say, oh, I've lost 30 pounds, the doctor doesn't immediately think, oh, did you adopt a whole plant food diet and begin an exercise program? They know the differential diagnosis is really more likely to be cancer.
Right.
So they're going to do appropriate testing, drug addiction, which certainly can be an effective weight loss strategy, or an eating disorder. So most doctors are going to immediately think, oh my, do you have an eating disorder, a drug addict, or are you dying from cancer? Way down on the list, if it's even on the list, would be you've made radical diet and lifestyle changes in your, because they don't see that. Many doctors, you talk to diabetologists, they'll tell you they've been through their entire practice career. They may have never seen anybody get well.
Which is unfortunate.
I don't know if it was me, and none of my patients ever got well. I might start thinking maybe it's me. I don't know. That's
like, what's the common denominator there, right?
Nothing.
First, oh my gosh.
The point is, make sure a person's a good candidate for fasting. Make sure they rest and hydrate during fasting. And then make sure you carefully refeed it. It takes about half the length of a fast to refeed in a controlled setting. So a 20-day fast takes about 10 days controlled refeeding. And if you do that, whether you do it at a facility like the Children's Health Center where you're monitored, or you do it at home in conjunction with your local doctor where you can be monitored, you can do it safely, but you've got to follow the protocol. And that's why we wrote the book, Can Fasting Save Your Life? Because Can Fasting Save Your Life takes the 22 papers that we published in the peer-reviewed literature and our 40 years of experience and explained how fasting works, how to do it properly, not just to the individual patient, but to their doctor as well. Doctor reading that book has all the information they need, what testing needs to be done, how to interpret that testing, so that they can make sure their patient does this in a safe and effective way.
Totally. First of all, I mean, yes. And you pretty much answered most of the question I was going to ask you, but I want to drill down into a few of them because you have some nuggets here that are worth metabolizing, which I think is really appropriate for our conversation here. But I want to know how, first of all, curiously, where did you start? I've kind of listened to some of your other lectures. How did you personally get into the fasting space? How were you?
I was actually fourth grade. I remember I was a desperate basketball player. And my best friend at that time, whose name was Doug Lyle, who later became a PhD clinical psychologist and director of psychology. Anyway, he was much better than I was. He used to beat me. And I got really frustrated. Thought, well, I practiced, but it didn't work. And I thought, maybe if I could get healthier than him, I could beat it. So I started reading books on health, and I came across a book by Herbert Shelton And he had a very interesting idea. He said that health had cause, just like disease has cause. So if you wanted the healthy result, you had to do the things that caused health. And he said that health was essentially from healthy living. So it was diet, and he advocated a whole plant food diet, and exercise, and he advocated flexibility, strength, endurance activities, walking, hiking, biking, swimming, things like that.
Yeah.
And also sleep. He said sleep was when your healing takes place, that kick in the anabolic cascade of hormones. It was really important. And if you did the diet, you did the sleep, and you did the exercise, you would be healthier. So I adopted those diet and lifestyle principles, and it completely failed because he also adopted the diet and lifestyle. And now here I am, 65 years old.
Oh, your friend did, right?
And he's still kicking my butt every time we go out and play. And so it didn't work, but it did get me interested in this idea of health. In fact, I remember even as a teenager, I decided, I wanted to pursue this. The doctor I met at that time that was doing this kind of work said it was the best job because the patients did all the work, the body did all the healing, and the doctor to take credit for it. And I thought, that's the job for me. And I told my uncle, who was a medical doctor, at my 16th birthday, I always remember this birthday party because my mom had invited him to come over and talk some sense into it because I had adopted this vegan diet. And my uncle, the medical doctor, told my mom, don't worry, these kids all do different dietary things. As long as he has plenty of gefilte fish, he'll be okay. And I said, no, uncle, you don't understand. It's called being a vegan. We don't do any animal food. It's called being a mashugana, and you'll stop it right this minute. And so I thought, okay, so he's upset. But while I'm here, it's the 16th birthday party where the father in our family has this talk with the son, about what you're going to do for a living. And so I decided I would save my dad having to have the talk with me. And I told the family that I had decided on my career path that I was going to pursue this alternative medicine. Yeah. And my uncle was a very... That was exciting.
That was weird. You still there, though? There you go.
I am.
Keep going. Not out. That was
my uncle, who was a very traditional medical doctor, said, no, nobody in our family would go to a doctor like that, let alone become a doctor. And he said, better you should be a communist spy. And he was very upset. I thought I was going to see my first stroke. His vessels were really sticking out. But anyway, finally he left. And my dad, who was pretty serious, took me aside. He said, son, I don't know anything about this alternative medicine, he says, but anything that makes him that angry and mad, it can't be bad. So you stick to your guns and good luck to you. And so interesting enough, 20 some years later, when I got out of school, my father, who was having TIAs and was having some real serious health problems, comes in and fasts for 26 days, fortunately has a very good outcome, and 20 years later helps edit The Pleasure Trap. So he had a really good turnaround. Worked out. My uncle, meanwhile, I get out of school, we decide I'm going to prove to him. So we decide we're doing a trial. We're going to do a trial on hypertension because we're seeing a lot. I'm calling him from Australia. I went to chiropractic college in Oregon, but then I went to osteopathic college in Australia. So I'm in Australia and I'm seeing these people being treated with high blood pressure with fasting. I said, Uncle, these people are getting better. And he goes, no, they're not. I said, no, they're getting better. I'm taking their blood pressure. He says that you don't know how to take blood pressure. I'd been in practice for 50 years. They never get better. They never get well. So I think I'll show him. So we come back and we start doing very carefully controlled data using standardized protocols so we could publish a paper on the treatment of high blood pressure. We collect 176 consecutive patients with hypertension. And it turns out 176 people normalize pressure without the use of medication. And so we get this paper together with the help of T. Colin Campbell from Cornell University. And my uncle will not look at the data. He'll have nothing to do with it. He's not going to waste his time until it's published in a peer-reviewed journal. So we finally get the paper accepted with Dr. Campbell's help in a peer-reviewed journal. 2 months before it comes out, my uncle has a massive heart attack and dies. Oh. And my mother swears he died just so he wouldn't have to admit he was wrong. But I think it was the Kugel and the Kreplach and the Blintzes and the conditions, but we'll never know.
What a story. And talk about your family was the perfect place to work these battles out, even in your family of origin. My goodness, not just in the medical field, but like back at the family gatherings. Wow.
So the fun part of it, though, is one by one, the family has adopted the diet and lifestyle factor. My brother was the last holdout. My brother was 5 years older than I was, and very brilliant guy. I mean, this is a guy who gets the 790 on his math SAT. 800 is perfect. And he knows the problem he missed, but he disagrees. He thinks they got it wrong. You know what I mean? That's the kind of guy. So he's working for Boeing Airlines, and he won't make the diet changes. Meanwhile, his wife develops a problem, comes in and fast, gets well. She's vegan. She's been vegan for 15 years. He keeps getting bigger and fatter and sicker. And so finally, can't play volleyball anymore. He's got arthritis in the knee. I get the call from the hospital. He said, Alan, I'm in the hospital. I said, what's the problem? He says, I had a heart attack. I said, well, that's wonderful. He said, now you're going to have to make the diet and lifestyle choices. He goes, no, I had a heart attack. I said, I heard you. Best thing that could happen to you. So meanwhile, they want to do a bypass procedure. I said, well, why don't you talk to the surgeon and ask him about alternatives? The surgeon knows him. He's a friend of his. He says, you need to have the bypass. He goes, why do I have to have the bypass? He goes, it'll last longer than the stents. If you put stents in, it'll come back. And he says, well, what if I made radical diet and lifestyle? He said the surgeon started laughing uncontrollably at him. He said, Mark, look at you. You're not going to make diet and lifestyle changes.
Wow.
He checks himself against advice, makes the diet and lifestyle changes, loses 50 pounds, passes his stress test. To this day, now it's years later, he's not had to have surgery, doing great, following the protocol. And it helps that his wife has already been doing it for 15 years, so she keeps him in line. The point was, even my own brother struggles because it's really difficult to escape the dietary pleasure trap. One of the things that helps that is fasting. Fasting, it's like rebooting the hard drive on a computer where you flush the memory out. The thing's not working, you turn it off, you don't know why, now it's working. Well, that's analogous to what happens to people with fasting. You shut everything down, you clear out the gut microbiome, they go through an intense detoxification. When you reboot the system on a health-promoting, high vegetable cellulose diet, you grow the normal flora back, the inflammation goes down. In fact, every marker of acute inflammation, all these acute phase reactive proteins all go down in fasting. And you can get off the medications. You can normalize function health, assuming that you're an appropriate candidate to begin with. Obviously, there's many conditions that are not going to respond to fasting. We focus on the things that are usually conditions of dietary excess. So your obesity, your cardiovascular disease, diabetes, autoimmune disease, and some forms of cancer are ones that will be responsive to this type of prevention. Other ones are not going to be so responsive. So we don't work with those because they would mess up our outcome. So
exactly. And I appreciate you knowing those limitations and knowing where to steer people that come to you looking for the magic bullet of this when it is not appropriate for everybody, but appropriate.
And there are some conditions like, with cancer, you may have cancer that needs to undergo aggressive therapy, but sometimes you can minimize some of the side effects from traditional treatments with the use of a healthy diet and lifestyle and fasting. In fact, it's remarkable in my experience, the dramatic difference in secondary side effects in healthy people to sick people when they're undergoing some of these very aggressive treatment. And some therapies, particularly some of the newer immunotherapy, many of our patients don't even have secondary side effects. A lot of the comments we get from oncologists is, wow, that's the best patient I've ever had, because they were successful with their necessary treatment, but didn't get some of the untoward secondary effects, which are not just the treatment, but the effect of the treatment on a body that's profoundly inflamed.
Exactly. I love it. Well, you spoke to a few things that I think are really worth highlighting. And one of them is around the belief systems, expectations, and limitations that clinicians actually put on their patient, which I think is really interesting.
If you've been in practice and treating diabetics for 25 years and nobody's ever gotten well, why would you think some quack from California making some diet change is going to be able to get people well consistently? If you've treated blood pressure and they never get well, why would you think eating differently is going to have such a profound effect that virtually all of the essential hypertension patients are going to normalize blood pressure and eliminate medication? Why would you think? You certainly weren't trained. As a physician, you had very little exposure to nutritional medicine in school. It's not considered a priority. It's not a thing that most doctors are aware of. And if you practice conventionally, they're right. People never get well. They'll tell you when you walk in the office, you have high blood pressure. Here are some medications. Yes, they may cause chronic cough, fatigue, impotence, or even death. But we promise you, if you do exactly what we tell you, you'll never get well. You will be sick the rest of your life. You will have hypertension until it or the treatment for it kills you.
Oh, truth bomb right there. And that's where, even in working with the clinicians that I train in the metabolic approach here, like helping people clean up their metabolic milieu, is getting out of our own way, like knowing that these patients have come who have been failed by the medical system over and over based on a lot of limiting belief systems and people's own, like you said, sort of trap, food trap, in their own lives, their own addictions to these pieces. Why would they compel a patient to do it if they're not applying it to themselves? Right. This is where the conversation needs to come right back, like rewind back. And so we really dive deep into these types of conversations. I really appreciate that you bring up that there's, even appropriate, inappropriate folks around this. You spoke to the very obvious metabolic driver, metabolic conditions, obesity, diabetes, cardiovascular disease, some cancers, probably Alzheimer's, neurological issues, other pro-inflammatory, processes. But I would love to hear from you. Who would be someone you would need to turn away from this particular type of fasting from
Sure.
your center?
So there's a lot of people that are not good candidates for fasting. For number one, any patient on medication that can't be safely withdrawn, you're not going to do water-only fasting on steroid medications, on anticoagulant therapies, because drugs can become profoundly potentiated. And whatever problems you think you have taking medications normally, give it to people in a fasting state, you got a whole lot more complications to deal with. So most people are being medicated, it turns out, not for their condition, for the diet that's causing their condition. So for example, a high blood pressure patient being for the diet that's causing their hypertension, as soon as you change their diet, you have to start modifying their medication because they'll start crashing. So because once you take the excess salt, the fat, the other things that are contributing to the hypertension, it's possible to safely, appropriately wean the medication. Now, some things can be done in days, some things in weeks, some things in years. If a person's on anticoagulant therapy because they had a pulmonary embolism, a deep vein thrombosis, they've had a recent cardiac arrest, these people are likely to be on anticoagulant therapy. If you just arbitrarily stop that therapy, you can induce a stroke. So that's not a good thing. So if you're going to withdraw that medication, that might take a year from the date of onset to safely withdraw that medication. At that point, you can reevaluate whether they're a candidate. But if you just put a person on a fast, continue your anticoagulant therapy, or just arbitrarily discontinue it, a certain percentage are going to have untoward events. And again, that's going to strip your safety data. On the other hand, there are modified versions of this where you put a person on a very healthy diet, or maybe even 600 to 800 calories of intermittent fasting or modified fast, where you can continue necessary medication safely without burning holes in people's stomach or potentiating the drugs and creating problems. And so when that's done by their physician carefully, that may be able to be done safe. And we certainly do a certain percentage of that at the Truman Health Center. But our focus has been identifying people that are good candidates for fasting and then using it appropriately up to 40 days. So it was Moses, David, Elijah, Jesus, and our patients that fast up to 40 days on water only. I've had people call and say, you fast them for 40 days. Do you also teach them to part the Red Sea? And I tell them, all on the wrist, it's like.
And it may feel like you can do things like that. If you already have those limiting belief systems of the ability to do a fast like that, for anyone who's listening, who's done this, you do kind of feel like you can part the Red Sea at different parts of this time. It's a pretty profound, even spiritual experience. So I love that you brought that up.
Isn't it interesting that the Moses, David, not just Moses, David, Elijah, Jesus, but the Jews, the Hindus, the Christians, the Buddhists, the Muslims, they all have a deep tradition and respect for fasting.
Yes.
And it's because fasting changes how you feel about yourself and the world around you. So you don't have to be a spiritual person to be able to get the benefit of fasting. Everybody gets the benefit, whether you believe it or you don't believe it. You just have to experience it.
I love that. And that's something that, you just spoke to it so beautifully. Every spiritual tradition since the beginning of humanity, fasting has been part of that spiritual awakening or that spiritual deepening or that spiritual connection. So I think that that's really interesting. I would be just curious, maybe just to speak to maybe a few of your favorite experiences you've had over these 40 years. I think 40 years is really cool with your 40-day approach as well, but maybe highlight one or two experiences you've witnessed in someone having their own sort of awakening beyond what they came in for, losing a few lbs and maybe getting off some medications. I'd love to hear some of those folks who were this sort of disbelievers coming in and having a very different life experience from this process.
Yeah. I mean, I've had so many patients, I think the most compelling are actually these studies that we published with hundreds of people. And we've got 22 of those studies and case reports that are just amazing. I know one woman that particularly stands out was actually the first patient that we published on the treatment of lymphoma.
Mm.
And this was a young woman who had had a stage 3 follicular lymphoma, excisionally biopsied, had been tracked for 2 years. They had her in a watchful waiting phase because they know, and it's accepted, that the treatment for lymphoma has limitations, that there is no remission.
Oh,
There
do
is
it.
no,
Here we go.
well, the sensors are coming out.
Really? I know. It's sensitive sensors here. Go ahead. Keep going.
So this was a case of follicular lymphoma that was well established, and it's accepted that the treatment has limitations. So it's not considered unethical to, get somebody well. And so we were able to take this person, and we recommended a period of fasting as a trial. And, this is stage 3 of upper and lower, easily palpated lesions. So something that's pretty easy to monitor. She had her CT scans and all her imaging. Went to the oncologist, who was told that diet didn't matter, that she could eat whatever she wanted to eat so long as she didn't lose weight, because that would be the only, God forbid. And that fasting was criminal quackery. So they did not think that would be advisable. So given that tremendous medical support, she decided to come to True North Health Center. She underwent 21 days of water-only fasting, during which time her tumors disappeared. We weren't able to feel any of her palpable lesions. We refed her for 10 days and sent her right back to her oncologist. And she was interesting. He said, when he saw her, it had been a month. And so he went and he started examining her. And he was having trouble because he couldn't find the lesions he had identified. And he looked at her picture on the chart, and he looked at her, and he finally asked her, he said, "What happened?"
Wow.
And she says, "I went to the criminal quacks and I did the fasting and the tumors disappeared." And he said, "Wow, well, that's interesting." And then I had asked her to make sure that she got a follow-up CT scan. And I said, there might be a little problem, but we really need that because we can't publish this if we don't document it.
Yeah.
And she said, "I'd like to get a CT scan to document the changes that occurred." And he became a little bit uncomfortable and said, "You don't need a CT scan." And she goes, "Well, but I want a CT scan." He goes, "Yeah, but you don't need a CT scan because you're better. I've been doing this for 25 years. And I'm telling you, those lesions have gone down. So we don't need to do anything right now except continue to monitor." And she said, "Well, what if there's cancer lurking right beneath?" I said, "Oh, fine, we'll do a CT scan." Does the CT scan. Dramatic changes available. So he also tells you that she's still hyponatremic and that maybe we should do a little gentle chemotherapy. He suggests, she asked, well, maybe we should wait and see if, the white counts. Anyway, long story short, a year later, she's got normal counts. We do follow-up whole body CT, completely cancer-free. And we publish this and submit it to the British Medical Journal, who there was a little bit of debate, but they decided that since it wasn't unethical to treat this patient, they supposed they could acknowledge that she appeared to get well, but maybe she just got lucky. Would we please follow the patient for 3 years? Because even when you treat a person successfully with chemotherapy, oftentimes there's recurrence and, it's a problem. So we followed her for 3 years. I told this patient she had to follow the whole plant food SOS-free diet very strictly, or it could be fatal because I would track her down and kill her. And she believed me because she followed the diet, maintained her weight loss. She was excellent. And she felt, fabulous. She was highly motivated. She had young kids. She wanted to see them grow up. She understood, what was going on. In 3 years, we did another whole body CT scan. She had maintained her cancer-free state. We sent the article back to the British Medical Journal, which rejected the follow-up study. And one of the reviewers said, "Oh, she probably just got lucky, just wrote it off." So we appealed to the editor. They did publish the follow-up. And so that was exciting. Then we started to get a lot of lymphoma patients because doctors felt they could then justify sending a patient over if they were in that watchful waiting stage to do a trial. And we started treating a significant number of lymphoma patients. Well, we put a case series together. We had one, there was a gentleman who'd had lymphoma, underwent conventional therapy, which had reduced the tumors, but then they blew up worse than ever. And so he was a failed chemotherapy. So we treated him, and sure enough, he responded well.
Wow.
And then we had one that had actually already metastasized into the bones, whose oncologist was quite antagonistic, until they saw him after 21 days of fasting, at which time the oncologist encouraged him to come back and do some more of that. Then we did a 39-day water fast. Now we've got multi-year follow-up. He's doing great, feels great, completely different clinical presentation. Well, we put all of these and this woman's 10-year follow-up, which we have, and we put that into a case series that's now been accepted for publication. It's either just out or just coming out. Of course, now what we're hoping to do is justify a clinical trial where people can be randomly assigned, get conventional care, and you know what happens there, or we'll try some fasting and diet and see if getting better is preferable to staying sick. So
My gosh.
we're hoping to do a good prospective study. And now that we've got this, initially the case report and now the case series, it's much easier to make the argument for this. The biggest problems we've run into is the HMOs are saying, well, yeah, maybe it's safe and maybe it works, but how can we scale it and get paid and make money doing it?
Scale, but really monetize is really the
right. How do you monetize this? So we're working on those issues right now. But the point is, to me, that was very gratifying because here's a condition that really doesn't have, it's not like we're arguing, displace some well-proven conventional treatment.
No.
And so it gave us a nice little window into treatment. High blood pressure. Again, our first paper, we did a second study on borderline hypertensive patients where they're high enough to justify treatment, but not enough to, you can avoid the medication issues altogether. Autoimmune diseases are very gratifying. We treat a lot of rheumatoid arthritis, ulcerative colitis, ankylosing spondylitis, psoriasis, eczema. And we've got some great case reports, including plaque psoriasis responding to 15 days of fasting after 19 years of hell in steroids, getting off the meds and resolving the problem. We've got some great pictures in the book showing the before, after. And again, every one of our papers is published in a peer-reviewed journal. We're trying to do a responsible job, not just blowing anecdotal smoke up people's dresses. So these to me are the most satisfying. I have to say, though, recently we've had some very compelling cases. One was we've been seeing a lot of patients with long COVID.
I was wondering
about COVID
water
that never recovered.
Yeah.
About 10% of people they're estimating, and they have brain fog and they have fatigue and they're treated not always very well. And so we have our first paper that was published on long COVID, 2 years of hell, a couple weeks of fasting, great long-term resolution. Interestingly enough, they got COVID, had a little flare-up of conditions, came in, did another 10-day fast, and now we've got good long-term follow-up. And then also we've been treating patients with COVID vaccine injury. These are mostly healthcare workers that are getting multiple boosters and activating underlying not saying causing, but activating underlying autoimmune disease, cancer, other problems. And they also seem to be responding, which is very exciting to fasting. But perhaps the thing that will be most surprising to you might be our most recent case report that's just been published. And that was a patient with lipoprotein a that was markedly elevated. Lipoprotein a is thought to be a genetically mediated cardiovascular risk marker that's thought to be genetic. So Medicare will only pay for one test. There's no point in doing a follow-up because drugs don't affect it. It doesn't change. And so we took this long-standing vegetarian who was a vegetarian, but he'd been having a little bit of hyperprocessed foods. He gained some weight. His blood pressure had gone up. We fasted him for 10 days. He lost, as you'd expect, 10 pounds, normalized his blood pressure, dropped 40 points. But his lipoprotein a dropped 40%. And then we said, well, isn't that interesting? I didn't even want to do it because I told the patient, listen, I've read the literature. This doesn't change. It's a genetic marker. It's untreatable. He said, I want to do it. I said, fine, we'll do it. So we do it. And I thought, whoa, wait a second. That's interesting. And then it turned out he was able to sustain it. So then I took just recently our most recent case report, a 79-year-old woman who is a 50-year vegan, SOS free, at weight, but has congenital hypercholesteremia and elevated lipoprotein a of 300.
Gosh, wow. We
did a 5-day water fast in this person that's already on the diet. At 6-week follow-up, 100-point drop in lipoprotein a.
And of
course, now we're doing a bunch of them. It turns out lipoprotein a may not be treatable with drugs and even vegetarian diet. It is treatable with fasting. And so now we're hoping to publish, a case series on this as well. And that's really exciting because I know one of my cardiology patients said, geez, if that was a drug that did that, that's $1 billion medication.
Hold on. It'd be on every headline. It would be on every news media outlet. It would be everywhere. And so, it's
Right.
interesting, Dr. Allen, you talked about the psoriasis plaques. My husband suffered with that. And well, let me start back. In 1991, when I was diagnosed with terminal end stage ovarian cancer, I had a complete bowel blockage and I had like the size of a fully pregnant belly of ascites, of fluid buildup. They sent me home to die. I had no expectation of overcoming it. But what I did by default and not by choice was fasted, because I couldn't, any idea of food made me very nauseous. Any
Right.
amount of food made me very, very, very sick. I would start throwing up and it would cause extreme pain. So the only thing I managed to do for 2.5 months, so this even exceeded your 40-day window. And a long story, I had people following me with labs because I worked in a clinic at that time,
Right.
was not eat anything, but just take small, small sips of water in over that whole period of time. My ascites stopped filling up so quickly. I didn't have to have it drained as much. It stopped, finally kind of just went away. The
Right.
obstruction cleared on its own, which is actually one of the recommendations we make for a bowel obstruction in the hospital anyway, is no
Right.
food, which is ironic. And so
Right.
over time, my own body doing nothing, and I was incredibly sick. I had a lot of other comorbidities, other health issues, a whole collection of autoimmunity. It
Right.
turned so many things around and off for me. My rheumatoid arthritis, my endometriosis, my polycystic ovarian syndrome, my Hashimoto's autoimmune thyroiditis. It revealed my celiac disease because I was weighing heavily. I was at that time
Right.
both vegan and a vegan at the time of my diagnosis, but I was very carb and very processed rich vegan, and so it made sense to what was going on for me. But that piece was so miraculous that it has been a tool I've used in my own life for whatever I get, comes my way. Fasting has still been along for the journey. My husband finally, begrudgingly, with his chronic psoriasis, did a 15-day water fast with me. And his psoriasis has, like, the 2 times it's kind of trickled back in quietly, he did a 5-day water fast and it was gone. Never. And he was someone who had it for the first 36 years of his life. And so
And what's interesting is you haven't cured it. You just managed it. You've got him healthy enough. If you put him back on a greasy, fatty, slimy, dead, decaying flesh, you could flare it up. And it's just like you've managed your cancer. You haven't cured anything. You've managed
Neil,
it. And
I
then,
love
you may get 40, 50 more years out of it. But the point is eventually, you'll probably get hit by a bus or something and they'll say,
Exactly.
see, it didn't work. It didn't work.
Yeah, this is the thing that I was so private about my story for so long, and maybe you or some of your patients have been, because when you do tell people, there's a lot of naysayers to it.
Oh, yeah.
Or like some of the stories you said, oh, maybe it was a misdiagnosis, or maybe it just was a spontaneous healing, or what have you. Nothing spontaneous about thoughtfully choosing fasting. And I want to qualify for the listeners, fasting is very different than starvation. How
Yes.
do you explain
So-
that? How do you
Yeah,
tell?
because fasting is the period of time when you still have labile reserves. If you keep fasting long enough, you enter a process called starvation, where you begin to break down vital organ tissue and then you die. So we don't do starvation because, again, it would really be bad for the outcome data. We're really careful about that. So fasting, though, is that period. And part of the reason how you tell that is you're working with your doctor for history exam, lab, and monitoring so that that doesn't happen. And
Yes.
we've proven that that can be done safely. We've actually published a fasting safety study in the literature where, we've had 25,000 consecutive patients. After a while, you start getting some confidence, it's okay. I think we're probably on the right track here.
I love it. Well, how do you prepare a patient? So your patients come. So I know I've had patients come to you who've spent a week. I've had patients come who've spent the full 40 days. You offer a lot of different things, and I'm assuming it's based on the individual, their goals, their medical needs. Walk me through how someone would, what's an onboarding process, an evaluation process, and
So the
how
first
do they
thing we do-
prepare before they even show up with you?
Right. The first thing we do is they fill out the registration forms on our website. We review their medical history. We offer them a no-cost phone conversation with me. So I'm going to go through their medical history and help them decide, is this something that they should even be thinking about? Or
Great.
maybe we need to refer them to somebody else that has a different approach for their particular problem. If they are a good candidate for us, we'll get them information so they can read about fasting. They can read our book, Can Fast and Save Your Life, and get educated, make sure they're comfortable with it. And then when they come in, they would be hooked up with one of our attending physicians. We have these kind of novel medical doctors. They're kind of like unicorns because they're
Wow.
not idiots. And so they will thoughtfully review their history and their exam And they're not doctors that are having to see 26 patient contacts a day and answer 50 emails because we do a much lower volume, a lot of time with a few people rather than a little bit of time with a lot of people. And so once the exam is done, assuming that everybody's on board and we all agree they're a good candidate, then we'll begin the fast refeeding process. Sometimes before they fast, they're going to eat the proper diet, weed down. Sometimes that they're ready when they come in. Sometimes it takes a couple of days to get them off their meds or deal with that. Then they'll go through the fasting process. You never know exactly how long that is because we examine patients twice a day, and we have a grand rounds meeting once a week with all the doctors so we can kind of go through and make sure, no, this is still working. It's working well. If we need to transition into juices or broths or other things, we'll make that transition. And then the careful refeeding for half length of the fast. So let's say, for example, a person has lymphoma. We want to fast until we can't see any more evidence of tumors.
Right.
In this woman's case, took about 3 weeks. And that seemed like a good place to break for her. In the gentleman's case, we knew we weren't done at 3 weeks because he had a very serious situation. But that was enough to get enough result that the oncologist would get on board and he would stop getting nasty letters from people. And then he did 39 days and, was successful. So sometimes it takes multiple fasts. Sometimes everybody can't fast that long. They may not have the reserves. You might have to do a short fast and then recover and then come back and do another. So you make it individual. You never know exactly, except in the end, we're brilliant. It's like you shouldn't have bought Apple stock for $1 a share too, by the way. What were you thinking?
Hindsight vision there.
Exactly. Hindsight is wonderful. And so the one thing we have an advantage of, because we've had so many people, we've got a pretty good chance, this kind of situation tends to respond.
Cool.
This isn't really such a good responding to this. We'll do something else. Sometimes they may have to go on a healthy eating program, maybe through the telemedicine practice, or if they have a local doctor that's willing to support them. And then they would get to the point where they're ready for the more vigorous water fasting type of intervention.
I love
Sometimes
it.
you don't have a lot of choice because they're so sick that if you can't get a turnaround, they're not going to be around. So you do things sometimes that are a little bit more stressful just because, they don't really have a lot of options left at that point.
Totally.
Although it's interesting, some of our biggest successes have not had to do with fasting. I'll give you a couple examples. I had one gentleman who came in who had recently become demented, and it was sudden onset, which is not, typical. He'd gone from not being demented to being fully demented. And so the doctor on our staff was very suspicious. He happened to be a patient with MS who was in a wheelchair, and he discovered that actually the patient had a bladder infection.
So common.
And sometimes people with an infection they look like they're demented. So ironically enough, he comes to the alternative health center, and what does he get? Antibiotics. He gets conventional treatment for this bladder infection, which wakes him up.
Wow.
It was like remarkable. And meanwhile, his drug addict kids who are trying to put him in a nursing home, take his money and snort it up their nose, are all upset with him being at our center, show up. But we don't tell him his dad is fully cognizant. He's totally alert. He's perfectly fine now. And the dad is sitting there not saying anything. And the kids are being abusive. And finally, the dad turns to him and says, well, let me tell you how it's going to be. It was the most fun I've had in a long time. That was
Oh my gosh. You're like,
we helped him get it hooked up into a situation where he wouldn't have. Anyway,
my
we
gosh.
also had recently published a case report of polypharmacy. So this was an 82-year-old who also came in where they thought was showing dementia signs. But the truth was he had recently had a heart attack. He had atrial fibrillation. He was hypertension. He was diabetic. A lot of problems, a lot of meds. We just changed his diet and carefully weaned off his medication. And by the time we were done, he woke up because he didn't have dementia. He had polypharmacy. And what was interesting was the reviewer that published this paper, one of the reviewers said, what an interesting and important case to remind people about the dangers of polypharmacy, too many medications interacting with each other. He says, but what made you suspect it might be the drugs?
Mm-hmm.
Because the fact is, these are standard medications. Nobody ever takes people off these drugs.
Right.
It's not part of the paradigm. And so in our practice, we're always seeing if we can safely withdraw medications and get people on the least amount of meds as possible, and preferably no medication. And since everybody we fast is weaned off of almost all medications, except for there are some exceptions like thyroid replacement therapy or some hormone, might be an exception, but almost all people are off drugs. A lot of the results we get, honestly, are getting people safely off their medication. Because as soon as they're off their medication, sometimes the body can start healing. And then if you don't put them back on the greasy, fatty, slimy, dead, decaying flesh, highly processed food diet, They don't need the medications because they're being medications for their diets oftentimes, not just their condition.
You remind me of, there was a time my husband and I used to work in a region of the four corners of the United States with an indigenous community, and they would have these annual sun dances, and they would bring communities from all over the United States, North America, actually globally. And I worked in the medical tent and my husband worked in the kitchen. And one of the things that these folks would do is, much to our chagrin as medical providers, because we're all trained to be scared to death of this, but they would come and spend a week dancing and fasting and drinking peyote tea and nothing else from sunrise to sunset. And they all would come and cold turkey whatever polypharmacy they were on. And we in the background are like the doctors, like waiting to like, oh God, here it comes. The miracles I saw I did this for 7 straight years. We never had to call in any emergencies. People lost massive amounts. I mean, in that week, people would jump 20, 30 pounds just in that time. Entire normalization of their blood glucose, blood ketone levels, entire normalization of their kidney function on the testing we were able to do in the field, entire normalization of their blood pressure, commenting that they can see better than they'd seen in years, that their pee stream was better than it had been in years, like their lymphedema, the circulation. I mean, we had tangible things out in the middle of nowhere, closest to hospital, 2.5 hours away from us, was terrifying. And as a medical student going through that process, I kind of always wondered if my career would stop before it got started. And I was humbled over and over again to see the power of this. And yes, there was the fasting aspect. There was the spiritual aspect that you alluded to. There was also this communal aspect. And I think that's one of the other things you bring to the table in your center. Can you talk to people what it's like because people come and stay with you? Is that correct?
Oh, that's right. Yeah, we have it's over 80 beds now, so we have a large facility, and they come from all over the world, and they do fasting. And so you tend to get people that are highly motivated, individuals that are serious about making diet and lifestyle changes. Yeah. And there's no question that a lot of these people, they'll tell you 10, 15 years later, they're still friends with the person they met because they have this common bonds that form. In fact, one of the residents of trained, one of the doctors actually did her PhD in the psychology of fasting.
Wow.
And she followed up with 600 people, and they answered these questionnaires. And they said, oh, what happened? Oh, I threw up and had low back pain and headaches and nausea and vomiting and skin rashes. Would you do it again? Oh, yeah. Was it helpful? Oh, yeah. I got, and they decided that it was actually Stockholm syndrome. The advisor said that there's no way fasting could have helped all these people like this. It must be Stockholm syndrome. They were so abused by their captors, that they began to identify with their captors. And the students said, but wait a second. Some of these people, it's been 10 years since they've been there. And, we know Stockholm syndrome creates over. Oh, well, maybe it's a new Stockholm syndrome. It's more severe than our old Stockholm syndrome. That was easier to believe, that the body just kind of heals itself if you get out of the way.
Right. Or that the patient became empowered and now understands themselves on a much deeper level.
It's interesting. It's much better now than 40 years ago, but people still think if you get on a plane in New York and you flew all the way to California, you would die over Colorado if you didn't eat the pretzel. They think the pretzel saved their life,
You're speaking to a person who, whenever I do international travel, so I just was in the Maldives a couple of weeks ago, and the only way I can survive that type of travel, the only way my body actually holds up from that 12 time zones, right? And the oxidative stress of being on that plane, the pressurization and my lymphedema that I get secondary to my cancer history. If I eat at all, do anything besides water, maybe some herbal tea, but I don't like to drink the water on the airplanes anyway, but just my own water on that plane, I do not have I recover quicker from any of the time zone pieces. So it's so hilarious that you say that, because literally on this last flight, I was on 17 hours. They served 5 meals during that time. And everyone was just like sitting there with their fork and knife on their table, waiting for it just to be shoveled in. I was just astonished that we did not move in there. So I think that's very funny that you mentioned that. It's like the concern of flying just cross country without something to put into your mouth hole is something that we have been led away from. And, this wasn't always the case. We really only changed our ideas about fasting in like the 1960s or 70s. We were using this more. What happened? What happened there?
Yeah. A lot of things have changed, and I think a lot of it's been driven by financial interests of the people that are, as far as they're concerned, things are working great. Now they've made, 72% of people are overweight or obese. So now they have these new wonderful drugs
I
that
was
you
going to
can
go
take
there.
these
Thank you.
drugs and they will make you so sick that your satiety mechanisms for ultra-processed foods will be somewhat reduced. Now they'll make you very sick, and most people that start them will stop them because of the side effect. But being overweight is so dangerous that even poisoning yourself with GLP inhibitors may have a short-term net gain, because you can manage to get some of the weight loss off by making your satiety mechanism more sensitive to ultra-processed foods. Now, there's another way to stimulate those GLP inhibitors and lose the weight. That would be adopting a whole plant food diet and exercise. But that's considered radical because it comes from the word radicus, which means root or cause. And also is not as lucrative as taking a drug for the rest of your life for $1,000 a pop that you can't even stop without blowing back up. So it's kind of the perfect drug, I think.
Yeah, I'm so glad you brought it up because it's such a controversial piece. And what I've also seen in that population is the body also tends to let go of its muscle mass and store up more fat and be more sensitive to that when they do stop or pause these drugs or can't tolerate these drugs any further. So I really appreciate the power of fasting in this piece. Two last questions for you. One of them is, your book is an incredible resource. What advice might you offer for any healthcare provider that's hearing this saying, I need to learn more. I need to know how to bring this tool into my patient population. What advice do you have for someone who's really new to this as a medical provider?
Well, I think the most valuable thing you can do is read Confess and Save Your Life, because I think it's well done. It's presented in a way that a physician gets the level of credibility that they need to have some confidence that the data is valid. We have another book called The Pleasure Trap, which explains why it's so difficult for people to make these diet and lifestyle changes. It deals with the psychological aspects of this as well. And the other thing they can do, though, is we offer a really unique training for doctors that want to do something worthwhile with their life. They can come to the True North Health Center. We have internship and residency training. There's no cost to the doctor. We provide, through the foundation, provide room, board, training, completely free. And they can actually learn how to get sick people well and teach healthy people to stay that way. And plus, I understand they get to go to heaven instead of hell. So it's a really nice package that we offer.
Your humor, I hope people understand your dry humor as much as I'm onto it. I love it. I think it's hilarious here.
Crack me up.
Well, finally, what I want to hear from you is, what do you see on the horizon? Because you've been at this for 40 years. May you see it for at least another 40, if not beyond this moment. But what do you see is on the horizon with regards to bringing fasting into our day-to-day lifestyle as well as into our medical systems?
Well, I think that on one level, today won't seem so bad by looking at what's going to happen tomorrow, because I think things are going to get a lot worse. And so hopefully they'll get so bad that we'll look back to this as the good old days. And then sometimes you get a crisis when things get really bad, and then people have to make a change. I don't know if we're quite ready for the crisis yet, because I think as far as a lot of the economic interests, things are working really, really well. But eventually that collapses in on itself, and then people will have to go back to the basics. And I think that the basic is really simple. For 200,000 years, we ate whole foods. For 200 years, we ate hyper-processed food. We're now paying the price for just a couple hundred years of hyper-processed foods. We got to go back to eating whole food. Yeah. And if we do that and get some exercise and sleep, we win. And you will not live forever. You're going to die, that's for sure. But you can dramatically increase healthy life. So how long you live is largely genetics and luck, but how well you live is largely the choices you make. Nice. And so when people start valuing the last 20 years of their life and want those to be the best 20 years, instead of finding themselves unable to talk or move, lying in a nursing home bed, waiting to come and change their diaper, then they're going to adopt the diet, sleep, and exercise advice that we're providing here. And hopefully this book will help make fasting a little bit more credible, so that small percentage of people that are serious about getting healthy will have a tool available to them that they can use safely and effectively.
My gosh, you just drove us home beautifully with that one. Dr. Allen, it's an absolute pleasure. Your work has been so integral to my own healing journey and to hundreds of thousands of my patients along the way. I look forward to at least another 40 years with you on these discussions. And thank you for bringing this information very timely.
It's my pleasure.
Dr. Allen, tell us where people can find you and learn more about you and have access to the care that you offer?
Well, if they go to our website at truenorthhealth.com and complete what are called the registration forms, that will allow me to review their individual medical history. We offer a free phone conversation with me so that we can kind of point them in the right direction.
Amazing. Amazing. And the books will be listed in our show notes as well in all of the ways to contact Dr. Allen. But what an absolute joy. Thank you so much.
Thanks for having me.